I'm Doc Emy Cua, and this is Mugshots Now, a modern digital Filipino media platform. Watch life from a new perspective, bringing a new flavor of fun, a new revolution of entertainment, giving you our best shot. As the expert, health is a state of body, wellness is a state of being. Mga ka-Mugshots, welcome to MugPahaba ng Buhay every Tuesday at 6 p.m. Please follow us on Facebook, Twitter, Instagram, and Facebook. Ang episode natin ngayon ay tungkol sa COVID-19 vaccination. Ang makakasama natin today is probably the most popular Filipino vaccinologist. He is actually currently based in Switzerland and very much involved with COVID-19 vaccine development and production. Let us all welcome Dr. Melvin Sanicas. Hi, Doc Melvin.
Hi, Doc Emy.
Say hi to our netizens po.
Hi sa mga nanonood ng Mugshots. Hello.
Yan. So, we won't take any longer. Punta na tayo sa pag-uusapan natin. Ang favorite topic natin, not only sa social media, kahit sa television, ito lagi yung pinag-uusapan every day. So, yung first question natin, Doc, is, can I choose which COVID-19 vaccine I get?
Okay, so this is a very important question. While there are many different brands of COVID-19 vaccines at this point, we cannot choose the specific brand because there are no doses available for all these different brands. And the most important thing at the moment is for us to get the vaccine that is offered to us so that we can be protected as soon as possible. I mean, it's not like waiting for a new iPhone or a new laptop, right? Where you can say, okay, let's wait for a year for a specific model, because doing that puts you at risk while you are waiting, and it will definitely prolong the pandemic and all the public health restrictions, the lockdown measures, and everything associated with the pandemic.
So, Doc Melvin, may difference ba dun sa mga COVID-19 vaccines?
So all these vaccines work by exposing our body to antigens, or yung particles that can trigger an immune response. And this immune response then protects us from future infection. The big difference between the different brands is the vaccine modality, or the type of vaccine that we are talking about, right? For example, we talk about inactivated vaccine, yung Sinopharm, Sinovac, or the vaccine from Bharat Technology, biotechnology in India. And then Pfizer and Moderna, these are mRNA vaccines. And then we also have Oxford, AstraZeneca, and Sputnik and J&J, the viral vector vaccines. So the main difference is really the modality of these different vaccines.
So, syempre kasi it's very confusing. There are a lot of vaccines available here in the Philippines. The schedule also of how it's given, nakakalito po siya. Paano po ba siya binibigay? Alin ba yung may 1 dose? Alin yung kailangan 2 dose? Ganun po.
So all of these vaccines at the moment, almost all of them, you need 2 doses except the J&J vaccine. Siya lang yung only 1 dose vaccine approved at the moment. And all of them are given intramuscularly. And the reason why they're given some muscles is because our muscles actually are excellent vaccine administration sites, because the muscle tissue contains important immune cells. And traditionally, the buttocks were thought to be an appropriate site for vaccination, but the layers of fat do not contain these cells that are necessary to initiate the immune response. Kaya most of the time they're given sa deltoid.
So, after ba vaccine tayo, when do we actually form yung antibodies na maproprotect tayo from COVID-19? Kasi I have some friends after vaccination, nagpapatest pa sila ng antibodies sa mga labs.
Yeah. So typically, 2 to 3 weeks after vaccination, you will see some antibodies. But di ba sabi nga natin, most vaccines require 2 doses. So it's normal to count 3 to 4 weeks after the second dose before you can be sure that you have these antibodies in your system.
So how well does this COVID-19 vaccines work?
Surprisingly, they work very well in preventing severe disease and death. And that's why this is really important, because imagine if we already had vaccines in the beginning of the pandemic early in 2020. we would have saved 3.4 million lives, right? And the different numbers we are hearing people talk about and compare are the vaccine efficacy against infection, and it's not against severe disease or death.
So, di ba, right now we have a lot of variants coming from the different countries. Does it affect the effectivity of the vaccine?
So vaccines create a broad immune response, and any virus change or mutation should not really make vaccines completely ineffective. And at the moment, both lab studies and real-world evidence, yung vaccine effectiveness studies na tinatawag natin, so these are the studies you do after approval, right? They all show that all the available vaccines are still effective against the variants. Now, the question is, until when? So perhaps 6 or 12 months from now, a certain variant may appear that can significantly evade these antibodies from the vaccines. But at the moment, that's not the case. That can happen, though. That's why it's important to vaccinate as many people as possible.
Okay, but now kasi I still have some friends who doesn't want to get vaccinated because of all the side effects that they hear sa TV, sa news. What are the most common ba? And is getting the COVID-19 vaccine really have life-threatening side effects?
So getting a COVID vaccine will typically give you mild side effects after the first or even the second dose. So it includes pain, redness, swelling where the shot was given. You can have fever, you can have headache, muscle pain, joint pains, you can feel unwell, but you will be monitored for the first 15 minutes after getting a COVID vaccine just to make sure that you don't have an immediate reaction that's severe. And most side effects happen within the first 3 days after vaccination and typically last only 1 to 2 days, and they resolve on their own.
Because syempre now we have senior citizens and people with comorbids getting the vaccine. So some of them, they don't really feel well after getting the vaccination. So they were asking if they should still take their medications after getting the COVID-19 vaccine.
Well, if it's a medication that they're taking because they have some chronic medical conditions, they should take it. But if you're talking about, taking pain medication before getting a COVID vaccine, for example, it's not really recommended. But okay, so it's not clear how these medications impact the effectiveness of the vaccine, but it's not really recommended to take it before. However, if you have fever after that's making you really uncomfortable, you can take medication after getting the COVID vaccine, as long as you have no other medical reasons to take these medications.
Okay. How about alcohol intake? Can people are just curious if they can still take alcohol after getting the COVID-19 vaccine?
So mild alcohol intake is okay. We do not see clinically significant impact on the vaccine with mild alcohol drinking, right? But I would recommend not to do so for the next few days. And the reason for that is because, alcohol can give you all these other side effects, right? You can feel hangover or headache or other things. And we might wrongly attribute these adverse events to the vaccine when in fact alcohol pala yung nag-cause nito. So I would recommend not to do so in the next few days.
I see. So our next question will be, who should not get the COVID-19 vaccine? And we'll answer that after the break. Hello mga ka-mugshots! We're back and today this is MugPahaba ng Buhay with me, Doc Emy. And our guest for today is Dr. Melvin Sanicas, a Filipino vaccinologist based in Switzerland. So the last question we were asking Doc Melvin was, who should not get vaccinated?
Mm. So at the moment, most of the vaccines are indicated for people 18 years old and above. Although Pfizer is now approved for a younger population, 12 to 15. So if you have the Pfizer vaccine, you can give it to people 12 years old and above, and the rest 18 years old and above.
Yeah, so now, syempre, the variants are coming. Do you think that we will need booster doses in the coming future?
Because the COVID vaccines have only been developed in the past year, it's really too early to know the duration of protection. And research is ongoing to answer these questions. However, it's encouraging to see that available data is telling us that most people who recover from COVID-19 develop an immune response that provides at least some period of protection. And so far, we can say 8 months. This is the natural infection. For those vaccinated naman, we can also say that around 9 or 10 months, since most of the studies started mid 2020s, and these people who have been given the vaccine are being followed up. So I would say that before the end of the year, we can say that the duration is 1.5 years at least. And then we are following them up. So pahaba ng pahaba to as we follow up the people who have been vaccinated.
So if somebody already had COVID-19 infection, does she need or does he still need to be vaccinated?
Yeah, because getting COVID-19, of course, might offer some natural protection from SARS-CoV-2 infection, but it's not clear how long and how durable the protection is. And because reinfection is possible, although rare, we have to say that it's rare, but it happens. And we know that COVID can cause severe medical complications, long COVID. It's really still recommended that people who have had COVID they still get a COVID vaccine.
When do they actually get the COVID vaccine after they recover from COVID?
Well, once the infection resolves, so no more symptoms, and once they've finished their isolation period, they can already get the vaccine. But if they were treated with COVID-19 monoclonal antibodies or convalescent plasma, they have to wait for 90 days before getting a COVID vaccine because they need to wait for the antibodies to be out of their system muna.
Okay, so talagang after 90 days, that's when they get.
If you had monoclonal antibodies or convalescent plasma, yeah.
Do you advise yung COVID vaccination sa mga pregnant women or nursing women?
So a very important question again. So none of the vaccine trials chose to include pregnant individuals, and that's normal. We don't really do that when we test for new vaccines. So our knowledge regarding safety and effectiveness of the vaccine for pregnant women is a bit limited. And so what the US CDC did was they tracked over 30,000 vaccine recipients who were pregnant at the time of vaccination. And so far, these pregnant women, they appear to have the same vaccine adverse events as the non-pregnant women. So meaning there's no difference in adverse events between the pregnant and non-pregnant women. And assuming the COVID-19 vaccine is available to you in where you live, I would say that you have two options to discuss with your OB. Option number one is get vaccinated as soon as the vaccine is offered to you. And this might be the better option if you are exposed to COVID patients regularly. For example, if you are a healthcare professional. The second option is you can wait until after you give birth to get the vaccine. And this is an option if you live in a city where there is no outbreak or the cases are very low. So I just want to emphasize that it has to be discussed with your OB.
Okay, will the vaccine baka it change my DNA or my baby's DNA? Does it have that effect?
No, but SARS-CoV-2, the virus, it has been shown to be able to cause long-term gene expression changes. In other words, SARS-CoV-2, the virus, it can it can alter your DNA. So I think it's important to tell people that saying COVID vaccines alter DNA, it has no scientific basis whatsoever. But COVID itself, it can alter your DNA. It's a fact.
Okay. If I get COVID-19 vaccine, tapos magpa-COVID test ako, tapos biglang, mag-turn out ba siyang positive? Or parang nag-positive yung COVID test ko dahil nagpa-vaccinate ako?
No, that cannot happen because none of the vaccines available at the moment, none of them are using live or weakened SARS-CoV-2 virus. The most probable explanation for that after getting the vaccine naging positive is most probably someone got the first dose and he or she became complacent and forgot about masking, hand washing, physical distancing, and so on, and got infected with the real thing.
Okay. Some naman, kasi di ba, they're so afraid of the side effects. Sabi nila, baka the COVID-19 vaccine will make me sick. What can you say about that?
Well, the COVID vaccines can make you feel sick because it's a potential side effect, diba? But it will not make you sick of COVID. It will not give you COVID because the available COVID vaccines that we have at the moment are inactivated or just using specific portions of the virus or just the mRNA. So we are not using the live virus as a vaccine at the moment for COVID, but there are live attenuated vaccines in development.
So after getting the COVID-19 vaccine, can I still donate blood?
Well, you can, but it's not advisable na immediate. Kasi I would think that it would be good to do that once you've finished your second dose and once you've finished at least 2 or 3 weeks after. So if the question is really can you donate blood, it depends on the situation, right? Like if you have a friend or a family member who needs blood and wala talagang ibang magbibigay, so you can. So I don't think there is a medical reason for you not to give blood. However, I think we should also remember that most blood donation centers might actually ask you to get a COVID test before you get before you can donate. And if you are positive, I don't think they will allow you to do that.
I see. Lately sa TV, there's a lot of debate on if senior citizens will be allowed to go out already, and some people were talking about herd immunity. So, how much ba of the population needs to be vaccinated para masabing really we have achieved herd immunity?
So different numbers have been mentioned for this 70%, 80%, 85% of the population needs to be vaccinated for herd immunity or population immunity or community immunity. Diba? There are different terms for this. But we are already seeing in the UK and Israel that the situation has dramatically improved with only 55% of the population receiving the first dose. And this is because really the more people are vaccinated, there will be fewer susceptible people for the virus to infect, right? And the outbreak is minimized and controlled. And our number in the Philippines at the moment is around 3 to 4%. So that's a long way to go, right? So when people say, why are the cases still increasing or not going down? Well, that's because only 3 to 4% of the population has received one dose. And this is like bringing a bucket of water to stop a forest fire, di ba? Parang you can't expect that to happen. So really the key message is for us to just vaccinate as many people as possible.
Okay, thanks so much, Doc Melvin, and I'm sure all our netizens have a lot of questions. So we'll answer all their questions when we come back.
Special thanks to Nagit Escorel Dental Clinic, Dermacare, Face Body Laser Center, Andy Passion Eyebrow Embroidery,
Hello mga kamag-shots! We're back here at MugPahaba ng Buhay with me, Doc Emy. And today our topic is about COVID-19 vaccinations with Dr. Melvin Sanicas, a Filipino vaccinologist based in Switzerland. So now sasagutin na natin ang mga questions ng ating mga netizens. So the first question is from Miss C from Makati. What if I don't get my second dose of vaccine on time? Do I have to repeat the count from zero? Does it have to be the same brand?
Okay, so first question, it is fine to miss the exact day for your second dose. In fact, many newer studies are showing increasing the interval between the first and the second dose improves the immune response. Ideally, same brand, but there are studies underway looking at mixing different brands. So, for example, in Spain, they have this study showing that mixing AstraZeneca and Pfizer vaccine, it's okay. And at the moment, the UK government is also doing these mix and match studies. So, bottom line is, as much as possible, use the same brand that you got first time around, but in the future, these guidelines may change.
I see. So actually now I have a question from Miko of Iloilo. Actually question ko rin to. Kasi di ba now there's a lot of political issues that the US doesn't want to recognize vaccine. People vaccinated from China vaccines, di ba? Yun something about the passport, vaccination passport.
Mhm.
So could getting two different vaccines actually boost the effectiveness, or is it really safe? Like kunwari, naka-Sinovac na ako ng dalawang dose, can I later on, when I have access na to Pfizer, can I get that vaccine?
So, because the existing COVID vaccines are already very good at preventing protection versus severe disease and death, I do not see how another vaccine can provide incremental benefit or provide further benefit on top of the current benefit. But actually, what I'm worried about is if people would do this, how about the others who have not been vaccinated at all, right? It's like taking away vaccines from the unvaccinated when you already have been vaccinated. So I do not think that this is good at the moment because we don't have enough doses, right? So we complain about the rich countries hoarding vaccines, but doing this is also like hoarding vaccine doses within the country, right? But let's say a year from now or 2 years from now, when everyone has been vaccinated, yes, you can do that. I don't see a reason why it is contraindicated. You can do that if there are enough doses.
Yeah. So the next question is from Tina of Davao. I know this is really siguro na confused din siya kasi 'di ba for a while the CDC released guidelines na kapag na-vaccinate ka na, pwedeng hindi na mag-mask, 'di ba?
Mhm.
So, do I still need to wear a mask and avoid close contact if I already had two doses of the vaccine?
So you know this guideline from the CDC was even controversial in the US. Madami ding experts nagsasabi na this should not have been done yet. But we are looking at the cases in the US and it seems like this was okay. This was sound, right? Kasi hindi naman tumataas ang cases and number of deaths. But for us, we always have to really think what is happening in the city or the region that we are in. Kasi if really at least 50% of the people have been vaccinated, you can do that. But at the moment, it's not the case. And even if you have been vaccinated and you stop masking, for example, you can be infected, but then because you have been vaccinated, you will be protected from severe disease and death, right? But you can carry the virus and pass it on to other people. So it's really advisable to still continue with the public health recommendations until a big portion of the population has been vaccinated.
Okay, thank you so much, Dr. Melvin. I really learned a lot and I hope our netizens also learned a lot. So we hope na next time ma-invite ulit namin kayo, I'm sure dadami at dadami lang yung tanong natin tungkol sa COVID-19 vaccine. So do you have any last words?
So for me, really, Emmy, get the vaccine as soon as you can, because the more people will get the vaccine, the faster will be the faster we are going to beat COVID. So yun lang. As soon as you are offered the vaccine, please take it.
Okay, thanks so much, Doc Melvin.
Thank you very much.
Thank you to our netizens na nanood sa atin tonight. I hope you really learned a lot. So, as the expert, health is a state of body, wellness is a state of being by Jay Stanford. Thank you mga ka-mugshots and see you every Tuesday at 6 p.m. This is Doc Emy Cua dito lang sa Mugshots Now. Magpahaba ng buhay. Please follow us on Facebook, Twitter, Instagram, and YouTube. Keep safe and God bless everyone.
Special thanks to Nagit Escorel Dental Clinic, Dermacare, Face, Body, Laser Center, Andy Passion, Eyebrow Embroidery,